Hello, it's Paul. This case is a EBUS FNA of a lung mass in the right lower lobe from a 58-year-old female. Clinical notes were query carcinoma, query lymphoma, or query other. So what did you think about this? There was definitely a foreign population of atypical cells present in sort of small and mostly fairly loose looking groups. There were a couple of areas that looked like rosettes. Cytoplasm seemed to be absent from some cells, but in other areas you could see, and there was a reasonable amount of it, it had quite indistinct borders and no obvious vacuolation, but the nuclei seemed eccentric. There was moderate anisokaryosis and particularly variation in size and shape from round to elongate cells. The nuclei themselves and the paps showed quite delicate chromatin, which was sort of finely stippled, and there were quite inconspicuous nucleoli present. So this looked malignant, I hope you agree. There was no obvious cilia in any of the atypical looking cells, so they weren't reactive bronchial epithelial cells. And the features really looked most like a neuroendocrine neoplasm, particularly the nuclei. So the combination of round and elongate nuclei, the chromatin pattern, and the absence of prominent nucleoli all fitted with that. Now, lymphoma was mentioned in the clinical notes, and there are a few reports of carcinoids being misdiagnosed as lymphomas in the literature. However, in this case, the cohesion of the atypical cells, the pleomorphic nuclei, and where you could see the cytoplasm, it certainly didn't look lymphoid. All those things, I think, allowed us to morphologically rule out lymphoma. Didn't really look like a high-grade neuroendocrine neoplasm like small cell. There was an absence of necrosis or apoptotic debris and mitoses, and there wasn't really that marked anisokaryosis and molding that you see with a small cell carcinoma. So really looked most like possibly a low-grade neuroendocrine carcinoma, like a carcinoid. Features that you sometimes see with those that were absent were the really anastomosing vessels that you can often see in FNAs. And remember, these can sometimes be spindle cell carcinoids as well, but they're usually found quite peripherally in the lung. Sometimes these tumours can be quite bland as well and really be intermingled with bronchial epithelial cells, look quite similar in size and shape as well, like this example here. Now, we had no fluid with this specimen, but we didn't need it because there was a core biopsy collected at the same time, and it was reported as consistent with carcinoid. The immunoprofile was positive for cytokeratins, CD56, chromogranin, synaptophysin, and TTF1, and it showed a low KO67 index. The patient went on to have a right lower lobe lobectomy, and this was confirmed as being typical carcinoid. So I hope you enjoyed that case. Thanks for watching.